Hello. So today let's talk about why MBBS graduates usually avoid preclinical subjects like anatomy, physiology, biochemistry, and what medical council could do to make them more attractive option. So in this first we'll talk about why MBBS students are not taking preclinical subjects. Firstly, we will see that there is a limited direct clinical application. We all have done MBBS, and after doing MBBS, our first priority is to do clinical residency. So there is like that's how we think. That's how we all think. Like we have to be uh, patient oriented. We have to choose a patient oriented stream. So that's how we are. But as we see, preclinical subjects are not always the first priority. Maximum time it's not our first priority. We compromise with our department or with our specialty, then we choose these preclinical branches. Secondly, there is no patient interaction. That's why there is more theoretical approaches to the subject. So that's why people avoid taking these subjects, preclinical subjects. Secondly, career and job opportunities are limited. Like as we see, mainly you can work in universities as a lecturer, you can become professor, and your growth is certain. It's limited. Mainly you can earn from that, or you can be a research scientist, so you can earn through that. Or it's rarely that you can get into the tech stream where you teach people. Like mainly it's educational purposes, nothing more than that. Third, social and professional prestige. Like as I have seen in my surroundings, many of my batchmates have taken clinical seats. There are rarely few, like out of 100 there are only 2 3 who has taken this subject, preclinical subjects, as their post graduation stream. So that is also one thing why people avoid these things. Like they judge you for picking preclinical subjects, always being judged. So that's one thing. Like even in my family, people judge not onto your faces, but behind you, they judge you for taking these subjects. That's the fact. Okay. And professionally also. Professionally, if you talk to other stream people, not all of them, but some people, they judge you for your uh, professional stream. They judge you for that. And that's the truth. So now let's talk about the fourth point, research culture gap. So as I have seen in my stream, like there is lot of research gap. You always have to integrate yourself with the clinical branches. Then you have a scope of getting research grants or your grants approval. It depends on that. So there is that. Lastly, the main thing, the main point of not taking preclinical subjects as their post graduation stream is the financial incentives. Everything is about money. Everything, why we work, why we are living. Right now, it's all about money. Before that, it was all about money, and in future, it will be always about money. So, in these subjects, there are limited opportunities, no direct clinical applications, so and no good research opportunities. So there is, uh, as you can see, like there is a less financial incentives given to them, very limited amount of money they can earn. It's not too much, so there is that. So that's why students avoid taking preclinical subjects, and there is a fact to that. So let's see what medical council can do to make preclinical subjects a better option, and it will be chosen by good rankers. The thinking will change, the dynamics will change, the curriculum will change, the approach will change, everything will change by making few changes for the betterment and for the quality of medical education. And this is the need of an hour. Pardon my English, I'm not very good at English, I'm just trying to be vocal about it, that's all. Okay, so Indian Medical Council should think about preclinical subjects. It's not dead, they are making it dead, and they are killing the MBBS dream. Like, as we say, after doing MBBS, we have a clinical exposure, we have a certain amount of clinical exposure. But as we do these subjects, preclinical subjects, we are lost in time. Like for 3 years, 3 to 5 years, we are away from the clinical part of our subject. So that's why I'll say, like, we will be lagging behind from others. So there is to that. So what medical council could do is they can integrate clinical relevance into the curriculum. Clinical approaches should be taught, patient interaction should be there, and they have to integrate these subjects with the clinical departments. Not clinical departments, they have to incentivize them. I think that's not a proper word. They have to give incentives for these subjects. Like what I'm trying to say, MD anatomy should be merged with diploma radiodiagnosis or clinical embryology, or we can say molecular pathology. So there should be a further approaches to clinical aspect of the subject, not limited to that. If somebody wants to do only anatomy, only physiology, only biochem, they have the option for that. But if student wants to pursue further education or further in their career, there is nothing beyond that. So that's the limitation we have created with these subjects. That's why students run away from these subjects. And if they want to pursue further as a clinician, they have to give the exams with the same pool of students which he has given given the exam as before. So that's the disappointing part. That's why students are taking more breaks. They are taking like 3 to 5 drops, and they are continue pursuing clinical subjects. So there is a big burden on the students, and like we can say the peer pressure which we have created, which NMC has created on students. So what more medical council can do? There should be a career expansion beyond teaching. Okay, so there should be a fellowship in molecular pathology, clinical genetics, forensic radiology, radiodiagnosis, pathology, any kind of stream we should be allowed to choose according to our certain specialty. There should be that. This should be done. This has to be done. Financial incentives. There should be lucrative financial incentives for preclinical subjects holders. That's how you will attract more students towards these subjects. And why we are talking about only these subjects? Because in vast amount, in variable amount of medical colleges, in private, mainly in private and government also, these subjects are, the seats are vacant because of many things. Students don't want to work these subjects. And who is responsible? Who is looking after this? Who is talking about this? I think no one is talking about this. And that breaks my heart. That breaks my heart. Even even our societies, which we have, like physiology society, anatomy society, they are not talking about this in their conferences, in their seminars, and they are not seeing the future scope of this. So we have to change our thinking. We have to modulate ourselves with the future aspect of the subject. We can't be living in the past. We have to think beyond today, beyond tomorrow. I think these are my suggestions. Whatever your suggestions are, you can, comment down in the comment section, and we'll talk about this more. Please like and subscribe to the channel. Follow for more.